Brenda Rodriguez. I oversee the care coordination department for all of our sites. In care coordination, we do a lot of outreach and connecting patients to outside resources. So I started 17 years ago, March 2007. I was hired for the front desk at our California location, our one and only California. Yes, we were there for the community, but we didn't have as much resources that we have now. We're a small team. When we had our meetings, we met in a small conference room, with 10 chairs, or we met in our waiting room. We received our notices through memos, just of paper. So it was very different. When I started, we didn't have care coordination. Everything was dealt by either the MA or the front desk. And the front desk did a lot. We didn't have a call center either. So we had to do phone calls, we had to register patients, check insurances. So we had a very wide workflow. And like I said, we didn't have care coordination back then. So when I started care coordination, it was just 12 in the team. I believe 12 or 14 care coordinators across California, Little Village, and just those two sites. And a small group, I knew we were doing a lot of patient resources, connecting them with transportation, assistance with medication. So I think what really motivated me, I know this is separate from your initial question, but working in the front desk, we were so limited of what we can do to provide a resource. And I have a really good story of a patient. But when IBCCP was introduced to us, as we were still working in the front desk, IBCCP provides a free breast exam, pap smear, mammogram to patients. So we were very excited because, like I said, we didn't have that when I started. We didn't even have a courtesy visit offer or an emergency fund. And I really wanted to do more than just the front desk. And we were very limited to have access to a patient's clinical chart, right? So that was one of my biggest motivations to move to care coordination. The 340B discount for the medication, I want to say that's really big. The Sabor y Salud, let's see, having that connection with them, allowing care coordination to speak to them and just letting them know what else Esperanza offers besides medical care and behavioral health, it just takes it a long way as well. Working in the front desk at Little Village, we had a walk-in. This is when the clinic originally opened. So providers had a lot of availability. And this lady comes in and she's like, I'm interested in a free pap smear, a woman's exam, because I haven't had one in a while, and I've had, just some issues. And I was like, well, can you stay today? We can see you today. And right away she's like, no, I can't because I didn't change my underwear, I didn't take a shower. But something in me was like, no worries, we have appointments available. I just need your ID, proof of income, if you have it with you. She's like, but I'm not working. I'm like, no problem, IBCCP, as long as you have your ID, we can connect you right away. I'm like, and if you give me a moment, I think somewhere in pediatrics, they might have free wipes. That can give you some wipes. So you're all set. No worries about not changing your underwear. She's like, I don't know. But she ended up agreeing and she stayed. So she got her free visit, a pap, her mammogram order. But there's more. Her mammogram came back that she needed additional imaging. She had a diagnostic, and it ended up that she had first stage of breast cancer. So she's always very grateful that we connected her to IBCCP. She ended up getting approved for the medical card, and that's just a story that stayed with me because she's like, I don't know why you convinced me, but you did, and I'm so grateful for that.